Okay, so we're just gonna scan the room, all the surroundings. Don't know if I'm going too fast. Okay. Okay. Hello, my name's Danielle Cooley and I'll be your nursing student today. I'm going to close the curtain for privacy. I'm going to wash my hands. I'm going to don on gloves. Can you tell me your name and date of birth?
Carrie Bird, 11/12/84.
Do you have any allergies?
Penicillin.
I'm going to verify this on the band. That looks good. Okay, and I'm just going to look over the physician's orders. Okay, that looks good. So today we're going to do an eyes, ears, and neuro assessment per the physician order. Do you have any questions about it?
No.
Okay, I'm going to make sure you're in a comfortable position. Are you comfortable?
Yes.
I'm going to make sure all my supplies are gathered. Okay, now we're going to do the eyes. We're going to check your eyes. So I'm going to ask you 3 questions. Do you need a prescription or glasses?
Yes.
Okay. Have you had eye surgery?
No.
Have you had an eye infection?
No.
Okay. So that sounds good. So I got 3 questions out of the way. Now I'm gonna check your peripheral vision. So I'm just gonna have you cover one eye. I'm gonna get my pen light for an object. And when you see this, I want you to tell me okay. Okay? So I want you to look straight ahead. Okay?
Okay. 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 Okay.
Okay, now we're gonna do the other eye. And just look straight ahead. And you can look at me.
Okay. Sorry.
Okay.
Okay. Okay.
Okay, and all of that was good. So now we're also gonna check your eyes to see if your extraocular movement, and we're gonna go through the 6 cardinal gazes. So can you just look at my pen light? Okay, so just follow the pen light. And as I'm doing this, I'm checking and making sure that her eyes move the same and that there's no lag with one, like one doesn't take longer or one doesn't wiggle as it's moving. So they were both had the same strength and they had the same movement. They were equal, which was good. Okay, so now we're gonna do the on cover test. So I want you to look ahead at the microwave and cover one eye. And now I want you to bring it down, and that's good. She had a steady gaze, how she should, and I'm gonna check the other side as well. And I'm gonna have you bring it down, and that was good. Okay, so now we're gonna check the eyes. I'm gonna check the irises and the pupils and make sure they're nice and round. I'm gonna check the sclera, make sure that color is normal. I'm going to check the lacrimal, and I'm going to check for edema or lesions. I'm going to have you close your eyes, and I'm going to check the lashes, and those are nice and full. I don't see any patches or unevenness. I'm going to check the conjunctiva. I'm going to have you bring it down, and I'm just going to look for any redness or swelling. Or I'm also going to check and make sure that it's nice and moist, and that looks good. So you can stop, you're good, thank you. Now I'm going to check, so I check the colors, the circular, everything is normal and even. So now I'm going to check now I'm going to check for her. I'm going to check the globes. They're good. I'm gonna feel for any bumps or lesions. I'm gonna ask her if she feels any tenderness, which is good. Now I'm gonna check with the pen light, and I'm gonna check for her, I'm gonna check her eyes and see if they're make sure they're glossy and that there's no abrasions with the light. So I'm gonna just have her look straight ahead, which is good. Okay, that was good. Okay, so now we're gonna check her pupil dilation and constriction. So I'm just gonna turn the lights down. Okay, and now I'm gonna check her eyes, and the one I'm gonna flash the light in her eye, and her eyes should constrict, her pupils should constrict. And I'm gonna check the one I'm shining it in, and that was good. And I'm gonna do it to the other one. And that was good. And now I'm also gonna check the opposite eye that I'm not flashing the light in and make sure they also constrict. That's good. And now I'm gonna do the opposite, and that was good. So her eyes dilated and constricted with the lights how they should. Okay, so now I'm gonna turn the light back on, and now I'm gonna have her look at the pen, and I'm gonna bring it to her nose. I'm gonna bring it away, and that was good. They went cross how they should when I brought it to the eye, and they also dilated how they should. They dilated and constricted how they should. So now I'm gonna move to the ears. So I'm gonna ask her 3 questions, history questions. Have you ever had hearing aids?
No.
Have you ever had ear surgery?
No.
Have you experienced any hearing loss or ringing in your ears in the past few months? Okay, so that's good. And now I'm gonna check the external auricles. So I'm just gonna fold the pinna forward. I'm gonna pull the lobe, and I'm gonna feel the tragus. I'm gonna touch the mastoid process, and that all looked good and normal. Now I'm gonna get my otoscope, and I'm gonna check her ear inside internally, and I'm gonna lift up. I'm gonna have her tilt her head, thank you, and I'm gonna look inside her ear, and I'm gonna ask her if she has an infection in either ear, and I'm gonna use the opposite. I'm gonna do the uninfected ear first so I don't get the other ear infected. So I'm gonna pull this up, and I'm gonna look in there, and so I see a pearly whitish gray tympanic membrane, so that looks good. I'm gonna go to the other side and make sure. And over here I also see a pearly grayish white tympanic membrane, and I didn't see any redness or swelling or any lesions or sores, so that's good. So now I'm also going to check for her hearing. So can you tell me what side you hear this on, and also tell me if you can hear it?
Okay. Left side, right side. Okay,
good. So we checked all of that. So now I checked her skin too and made sure there weren't any lesions or bumps or any redness. I'm also going to ask her that when I touched her ears, when I was checking the targus and folded her ear lobe and her pinna and pulled on her lobes, if there was any tenderness. Did you feel any tenderness? Good. So now I'm going to go to the neuro. So I'm also going to make sure that for her eyes, I'm going to just revert back to that real quick. I'm going to make sure that she can read. Can you read this?
Gasser Hardware and Farm Supply.
Okay, good. So I made sure she could read. So now I'm gonna go to the neuro. I've been checking her posture, I've been checking her facial expressions, I've been checking her her behavior. I've noticed she's not agitated, she's not irritated, she has been responding normal and appropriately, and she's been very patient throughout the whole process, which is great. So that's good. I'm also gonna check her, make sure she knows who she is, where she is, the time and place. Person, place, time, and place. So she already told me her name. Do you know around what time it is?
2:30.
And then do you know where you're at?
I'm at my house.
Okay, and so I'm also gonna ask her for the situation. So do you know what we're doing right now?
I've seen our skills video.
Okay, good. So now I'm also gonna have you remember 3 numbers for me. So I'm gonna check her immediate memory. So can you remember 3, 5, and 7?
3, 5, 7.
And can you say that backwards?
7, 5, 3.
Yes. So that was her immediate memory. So now I'm also gonna check her recent memory. Can you tell me what you ate for breakfast this morning?
A bagel.
Okay, good. So that was her recent memory, and now I'm gonna check her remote memory, which, can you tell me your favorite childhood pet?
My dog Tippy.
Okay, so I can do that, and I can also ask her for her birthday, which I did earlier. So now we're gonna check your 12 cranial nerves. So we're gonna check your olfactory. So I'm gonna have you close your eyes and tell me if you can sniff this.
Is it alcohol wipe?
Yes, good. So that was her olfactory. Now I'm gonna check the optic, which I already did earlier, which is her eyes. So that was good when I checked her optic. I'm gonna check her oculomotor nerve, her trochlear, and her abducens, which I checked with the cardinal gazes and stuff. And now I'm also gonna check her trigeminal. So I'm gonna have you open your mouth, clench your jaw, and I'm gonna have you close your eyes and tell me if you can feel
Forehead, cheek, chin.
Okay, good. So we got the trigeminal. Now I'm gonna check the hypoglossal, the glossopharyngeal, and the vagus. Okay, so I'm gonna have you open your mouth and say ah, and I'm gonna check. I would check her gag reflex, but I don't have the tool right now, so I'm just gonna note it. And I would also make sure that she can stick her tongue out and wiggle it back and forth. Okay, that's good. So now I'm gonna check her facial nerve. So I'm gonna have you smile, I'm gonna have you frown, I'm gonna have you puff out your face. Okay, so all of that was good. We got the facial. I would check the acoustic right now, but since I already did that previously with the hearing test, when I checked her ears, I know that she can hear good. So I know her acoustic is working, her acoustic nerve. So now I'm also gonna check the accessory nerve. So I'm gonna have you just shrug your shoulders, which was good. Okay, I'm just gonna go through them real quick and make sure I got all of them. Got the olfactory, the optic, the oculomotor, the pharyngeal, the oculomotor, the trochlear, the abducens. I checked the facial, the acoustic, the hypoglossal, the glossopharyngeal, the vagus. I checked the accessory and the trigeminal. Okay, so I've got all her nerves. So now I'm just gonna check her sensory nerves. So can you feel this? Okay, and now I'm gonna have you repeat what I do, and I'm gonna check your motor. So just do this. Okay, good. And now with your other hand. Okay, good. And now the last one I'm gonna check is her Babinski. So I'm gonna just have you lift your leg. Okay, so I'm gonna go from the heel and I'm gonna go up the side and over, and that was a normal response. Her toes didn't hyperextend, which was good. That should only happen if she's still a baby and hasn't learned to walk. So I did all of that. I'm gonna ask you, is there anything else I can do for you?
I think I'm good.
Okay. Thank you for letting me do this, and I'm gonna document per facility policy, and I'm gonna update the physician as needed. Okay.